When you or your family member has congenital heart disease, one important decision you'll make is where to go for care. To help you understand complicated congenital heart surgery information, we created the Hospital Navigator, a website that reports data shared from hospitals around the country. Reporting information about each specific heart defect or type of surgery is challenging because there are so many kinds of heart defects. A hospital may not see many of the exact same type of defects in a given year. It is hard to draw big ideas from small numbers. Therefore, heart surgeries are grouped into 5 categories, known as stats. Stat 1 includes surgeries with the lowest risk of death, and Stat 5 includes surgeries with the highest risk of death. The total number of surgical procedures a hospital does, called volume, is also important to consider. Prior research studies have shown that hospitals doing a greater number of high-complexity operations generally have better results. Looking at both volume and complexity of surgeries matters. In addition to volume and complexity of surgeries, another important piece of data is a hospital's survival. Hospitals that treat very sick patients are expected to have more deaths than hospitals who only treat patients who should do very well. This expectation is described by a mathematical formula called the observed over expected ratio, shown here by the colored bar. When the colored bar includes a ratio of 1, it means the hospital had a similar survival as expected for the type and complexity of patients they treat. A bar below 1 is better than expected survival, and above 1 means the hospital had worse than expected survival. The Hospital Navigator and the data inside are not designed to rank or compare hospitals, but to support an educated conversation between a patient and their care team. For more information, please contact your healthcare team or visit conqueringchd.org. Together, we are Conquering CHD.